The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome back to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, also known as the Confidence Doc. And today, I get to turn the tables. I was recently on Dr. Rovelo's podcast, and now I get to have her on mine. So please welcome to the podcast, Dr. Millicent Rovelo.
Hi, how are you?
I'm good. How are you doing?
I'm doing okay. Thanks for having me.
And she's joining us from Beverly Hills right now.
Yep.
So I always like to start out by tell our listeners how you got into plastic surgery.
So I got into plastic surgery. I actually thought I was going to be a trauma surgeon. I just really loved the adrenaline and the hype of trauma surgery. And then all it took was like watching one plastic surgery when I was a first-year medical student. It was like a pediatric craniofacial, like crazy craniosynostosis surgery at the Children's Hospital. And I was like, yes, that is cool. They took this baby's head that was misshapen and looked really funny, and they took it apart and then put it back together, and then it had this like beautiful normal head again. And I thought that was just so cool. And so that was sort of it for me. I never really looked back after that.
You know what's funny is that's actually one of the most, not that specific case, but most people will say that. They're like, I saw one case and I was like, this is what I got to do. And I kind of love that because it's just we all get attracted the same way to it.
Even as medical students or even potential medical students, you just don't get a lot of exposure to plastic surgery, like other than what you see on TV along with everyone else. And so you don't really understand what true plastic surgery can do, what true reconstructive surgery can do until you see it. And then once you see it, it's like, oh man, like that is cool.
Yeah. I mean, we do have pretty much the coolest jobs ever. So.
Right? Yes.
Now,
Absolutely.
I know that you were double board certified, which means that you're general surgery and plastic surgery board certified, correct?
Correct. Yes.
So
Yeah,
can you explain to our listeners like what that means? Because there's obviously more than one pathway to plastic surgery now.
Right. So there are a couple different ways. Historically, the more traditional one is the one that I took, which is where you do a full 5-year general surgery residency. So I did 5 years. I did hernias and gallbladders and pediatric cases and like everything under the umbrella of general surgery. I took my general surgery boards. And then I also did a second plastic surgery residency for an additional 3 years where we learned all about, obviously, plastic surgery. So that's the kind of the more old school route. I think most programs now are more integrated, which means that you come out of medical school and you go straight into 6 years or 7 or 8 years, depending on how much research you do, of just straight plastic surgery. But even those straight plastic surgery integrated programs, they incorporate a decent amount of general surgery, especially in the first couple of years, to kind of just like teach you how to operate, like the basics of surgery.
And you have been, you're in solo practice, correct?
I have two practices. So
Okay.
My one practice that is solo is, yes, it's just me. And then another practice that I'm at part-time as well is more of a group practice. It's a hospital-based practice. And so I am considered medical staff with all the other medical staff, doctors and surgeons, so general surgeons and endocrine and dermatology. All of us are under this medical staff umbrella. And I am one of 3 plastic surgeons as part of that group.
So why did you decide to have that balance where you have this practice and that practice? What about it, I guess, appealed to you?
Yeah, it came about very organically. Like I had initially opened my own practice and, you know, it was slow going in the beginning when you first open your doors as a brand new plastic surgeon. It's not like people are like banging down your doors to come to you. Like, oh gosh, I've been waiting for you to open practice.
Yeah.
So I needed something to
I wish.
Right? Like they're not doing that. So I kind of needed something to supplement. And I heard about this position that may or may not be open kind of through the plastic surgery grapevine. And so I just reached out to the medical staff directly and was like, hey, if this position is even at all available, I'd like to come in and talk to you. And they're like, well, it's not really, but why don't you come in and talk to us anyways? And so then I came in and they weren't sure if they wanted me and I wasn't sure if I wanted them. So we settled on this like part-time situation. And it worked out really well because it allowed me to keep my own practice, which I love. Like my practice is like my little baby that I grow and I hatch, while also still having sort of the security of a steady, supply of patients and all the paperwork just handled for me. Like I just come in, I see patients, I operate, and I go home. All of the other stuff in the background is handled for me. So it's a nice blend.
You get a little bit of both worlds.
I get a little bit of both worlds. And I do, at the hospital-based practice, I definitely do more of the reconstruction stuff. So there is a breast reconstruction element. There's a lot of breast reductions through insurance and things that go more insurance-based, but also a lot of body contouring and post-bariatric surgery that happens here as well.
And I know that's one of the things we share in common is that love for that post-bariatric surgery. What would you say are kind of your favorite procedures that you like to perform?
Gosh, it's always it shouldn't be a hard question, but it is. Look, I just like to do it all. But I think in the post-bariatric or post-massive weight loss body contouring patient, what I really enjoy doing are the body lifts. So particularly the lower body lifts. So as you know, when you lose this much amount of weight, it's not like you just have extra skin in the front, like a mom that had a baby or two. No, you have extra skin that goes all the way around the hips, around the back, towards the buttocks. And if you just cut off the front part, like a traditional tummy tuck, you're left with all this extra hanging skin on the sides and on the back. And sometimes you can get away with it, but if you have a patient that wants to do the full deal and really make a big difference, if they allow us to do the full circumferential incision and get all that extra skin from the sides, from off the buttocks, from the back, like the contouring that you can do is just so dramatic and so satisfying.
I agree. It's just like, you feel like you really get to like reveal that person, their inner person there.
Yeah. And there's nothing worse than doing the tummy tuck. Even if you do a ton of liposuction and you take all this skin from the front of the abdomen and then they look great. They look so much better. But you're just like, those sides. I just wish they could be like less, like get some of that extra skin off the sides there. So when I can, I do love the body lifts.
Well, what I think is neat is, you're someone who's like very experienced in doing these areas, but then you're also a really excellent facial plastic surgeon too.
Yeah.
And I think that you don't see that as often. So what would you say your favorite facial plastic surgery to do is?
Well, that's a good point. What I've really been doing a lot of lately on its own, but also in combination with traditional facelifts, is the mid facelift. I think the mid face, just sort of for definition purposes, is literally like what it sounds like. It's like the middle of your face. So it's everything from sort of the bottom of the nose up to the brows. It's that midsection of face. And that's a really tricky area to treat surgically, and I think it gets ignored a lot. But if you can do a mid-facelift and really elevate the tissues back up onto the cheekbone, sort of where they came from, then it can be a really powerful technique to rejuvenate and make people just look so much younger and more refreshed. And it's not typically addressed with a classic facelift. Most facelifts just address the lower part of the face. So being able to do the mid-face, I think, is just so powerful. And you can do it on its own, like in younger patients who don't quite need a full facelift. But that one part of the face, the mid-face, is where you're going to see the signs of aging first. The lower lids, the cheek. And so you can do it as a standalone procedure in that younger cohort of patients.
If it's done as a standalone procedure, because I feel like we're seeing more people getting that as a standalone procedure, how do you access that area? I guess would somebody expect a typical facelift scar, or is this something different?
This is very different. So this is going to be done mostly endoscopically. So the way that I would do it is you get 2 incisions kind of in your hairline, behind your actual temporal hairline in the scalp. And then depending on what you need, most people do need some form of a lower blepharoplasty as well. So there would also be an incision in the lower eyelid, so transconjunctival. It is an incision inside the eyelid, but you don't see it because it's inside the eyelid. Although I did see somebody on TikTok the other day being like, I had a scarless lower blepharoplasty. He did it transconjunctivally. I was like, girl, you have a scar. It's just...
Everything has a scar. It's just where
it wasn't scarless. You have an incision inside, but it's inside your eyelid, so you don't see it. So there are no scars on the face. But through those incisions, you're able to go in endoscopically, so with the camera and with like long, deep instruments, and release that ligament that tethers the lower lid and the cheekbone, and release any fat that might be protruding in that area, and just really smooth out that lower lid chink junction, and then raise the cheek up, put some sutures in internally, and then close up the incisions in the scalp. So no, you're not going to have the traditional like around the ear incisions. It's not a facelift in that regard. You can do it all through sort of these, well, scarless. It's a scarless procedure.
That's right. As long as you don't shave your head, you're fine.
You'll never see them.
Well, and so really this is like someone who maybe, like, because a lot, again, when people think about facelift, they think about, okay, well, I'm older and I have all this, but this is somebody who really, it's really just isolated. You don't necessarily have jowls and you're not at that level yet.
Right. So it's really when you start seeing that as an isolated procedure, this is going to be patients who are like in their mid to late 30s, early 40s, where that's really where they're seeing the first signs of aging, that periorbital area. So it's typically combined with an upper blepharoplasty, the lower blepharoplasty like we talked about. But if you have a patient that is getting an actual facelift, you can also do this at the same time to address not just the lower face, but also the mid-face and the brow. Because a lot of times the brow is included with the mid-face because it's the exact same incisions. You're pulling similar vectors, like you're literally right there. You might as well just snag the outer portion of the brow and pull it up at the same time.
What's the kind of recovery with that? Basically it's a minimally invasive procedure.
Right.
So
yeah, that's a good way of putting it. It's a minimally invasive procedure. Depending on how aggressive you get and how much else you're doing, I know a lot of times I'll combine this with the laser as well, and the laser can make you really swollen. But you can be puffy, you can have some black eyes for sure for a couple days, as long as the swelling and the black eyes take to resolve. But you'll feel okay. It's not a super painful procedure. Certainly by a week, you'll be moving around okay, you're feeling okay, you can be back to work. But people will notice that you've had something done because you're going to be a little puffy, you're going to have some bruising. And sometimes depending on the extremeness that you need for the mid-facelift, the lower eyelids themselves can have sort of a strange cant or tilt to them. So you might look, like your eyelids are pulling up towards the side and kind of like a fox eye look. That goes away after about 6 weeks. But in the beginning, for some patients, it's a little bit like, whoa, am I going to look like this
What
forever?
did I do?
Like, no.
Yeah.
Those are going to drop. You're not going to have that slanted eye look forever. But you kind of have to hold their hand and walk them through that a little bit.
How do you set expectations for the longevity of something like that?
This procedure lasts. I mean, this one, once you because it's the ligaments, right? And I think this is true for a lot of face surgery. The ligaments that tether the face, these are dense structures that go from the skin down to the bony structures of the face. And they're all over the face. And for the mid-face, they're in that lower eyelid / cheek junction. That ligament needs to be released. Same thing when you're working on the lower face and you have to release those ligaments that contribute to the jowling, the extra skin that hangs down on the side of the cheeks. Once those ligaments are released and the soft tissues are redraped, the results last. Because yes, you will continue to age, right? Gravity's still going to do its thing, but you're not going to age in a classic aging fashion because there aren't any ligaments to create that jowling look or that step off from the lower lid to the cheek. So you just age better. It's not going to last you because gravity and aging still work, but it lasts and you age different and you age better, like more smoothly, if I had to say anything.
And are there ways that are basically, is there an old fashioned way of doing a mid facelift, or is this really, since people started doing it, it's really been an endoscopic approach? Does that make sense?
Yeah, no, it does. There are other ways
Yeah.
of doing it. Some people will actually do the whole thing through the lower eyelid, and they'll release the canthal tendon on the outside of the eye and go in that way. And instead of doing it endoscopically through the hairline, they'll do it all through the lower lid. A little bit harder, a little bit higher risk of some eyelid malposition when you do that, so that's not my favorite. And then there are just some old school ways of doing like a super deep, like subperiosteal facelift, where you go in through your actual facelift and release all of those ligaments as well. But that, I think, that's a very old school facelift technique that I don't know that many people do anymore. I think most people who are trying to kind of create a natural look while limiting like the downtime and recovery will do a bit of a blend of both of these procedures.
Okay.
And then there are some people who don't do any kind of lifting of the midface, and they'll camouflage it with fat grafting, which is another option as well. Rather than repositioning everything, you just find that hollowing in that area where there's that step off, and inject fat there to sort of blend and smooth the area and not have to do all of the aggressive lifting.
So in your opinion, as somebody who does do a lot of these, do you feel like your long-term result is better by lifting your tissue rather than fat grafting, or you feel like both can give you good results?
I think both can give you good results, but the long term is going to come from the lifting. I mean, anytime you use fat or filler or anything like that as a standalone substitute for a lift, you're never going to have the kind of results that you can have with a surgical procedure, because you're camouflaging the problem. You're not solving the problem, which is that the tissues have fallen. So I think once you can solve the problem, you're going to have better, longer lasting results than trying to just minimize and camouflage the problem.
Yeah. And I think that makes sense. I mean, a Band-Aid is a Band-Aid.
A Band-Aid is a Band-Aid, right? It's going to come off at some point.
Let's talk a little bit. We talked, we spaced about, what about breast reductions? I know that you say that you really can make a designer breast reduction.
Right.
So what do you mean when you say that?
So for me, this concept of a designer breast reduction is that you want the breast to look really good and not just smaller. Like, smaller is great, and most of the patients are really happy with just smaller. But I think that if that's how you're looking at it, you're really missing the opportunity to make a beautiful breast. And not everyone's going to need the same thing. So you kind of have to ask the patient what it is that they want. Like the other day, I had a patient come in who had a large breast, but most of the volume was in like the very lower portion of the breast, and she had really no breast tissue at the top of the breast. Everything was hanging down by her belly button. And so in her, if I had just done a classic breast reduction, she would still have had a very empty top portion of the breast. The breast would be lifted, they'd be cuter, they'd be more rejuvenated. But what she was asking, she's like, well, I really want volume up here. She kept like pointing up towards her clavicle. And so I was like, well, the only way that we can get volume up there is with a small implant. So we used a small implant. I used some mesh to support the implant, and then we did the reduction. So that was because that's what she came in asking for, was I want more volume up here. And then you have some patients who have had a massive weight loss, or they just have very large, stretchy breasts. I have a lot of young patients that for whatever reason, their skin is just really stretchy. And so yes, their breasts are large, but a lot of times what brings them in is that they just sit so low on their chest because the skin is so stretchy. And so those are patients that would really benefit from having some kind of dermal mesh. I use Galaflex to work as an internal bra and support the soft tissue and skin. Because without it, even though their breasts are smaller, they're going to sag really quickly again because that skin is just so stretchy. And then some patients also need additional liposuction, or sometimes they need just a little more like contouring of the whole chest area. That could even be as much as a upper body lift or a bra line lift to get rid of extra side skin. So a designer breast reduction for me is really looking at the breast, asking the patient what it is they want, what's their dream breast look like, and then how can we add in these adjuvant techniques to really make it a beautiful breast and not just a smaller breast. A result that lasts.
And I think it goes back to like back in the day, breast reduction was just like you said, okay, we make them smaller.
Yeah.
But, we want them lifted and we want them cute. We want the shape to look nice. And
Right.
I think especially in younger patients, like their expectations are higher. And, and we want that for them as well.
Yeah, for sure. And the younger patients, they're so well versed in social media and marketing, and so they've seen what's available, and they should have that. I mean, everybody should have the chance for beautiful breasts, but you do want these younger patients, their results to age well with them.
Yeah, for sure.
Yeah.
So how would you say that most patients end up finding you? Right? Like, is it word of mouth? Is it, is there certain marketing you do? I'm always just curious, how do people find you after you've been in practice for some time?
I would say the majority of my patients are actually word of mouth. So, I operate on a friend or a family member or a friend of a friend of a friend. So that's, I would say, the majority of my practice. And then I think the rest of them come in through like a good old-fashioned Google search. I'm sure, as you're familiar with, the podcasts definitely help when patients can listen to you and understand like what it is that you do and how you approach things. It makes them a much more comfortable coming in and seeing you and knowing that like they kind of feel like they already know you and your approach a little bit already. I don't know that I get a whole lot from traditional social media. So Instagram and TikTok, mainly because I suck at it. Maybe if I was better at it, I'd get more patients from it. Funny how that works. But that's not how I get most of my patients.
And I could not talk about the Beverly Hills podcast because that's how we got to meet.
Yes.
But I know you've told me this before, but I'd love for our listeners to know, like, how did you guys get started with this? I know you do it with Dr. Jay Calvert, but you guys aren't in the same practice. So how did that whole thing happen?
Yeah. So my podcast partner is Dr. Jay Calvert, and he and I work together in tandem. Like our offices are in the same building and same office, but our practices are separate. So there's no like financial mingling, but we work very closely together with the same staff. We share the same OR, things like that. And so we have worked together since I came out of training, actually. He and I have been together working. And he already had a podcast because he's very into hockey. And so he had this whole like Dr. Hockey podcast thing that he did. And then at some point I had a friend who was like, you should do podcasting because I always ask you these questions and you're giving me honest answers. And I want everyone to have that opportunity to get like honest answers from a plastic surgeon. And so I mentioned it one time to him, and then he mentioned it one time to me. And finally we were like, okay, well, let's just do this. Like, let's just put together a podcast. Because he's like, I'm not going to do it by myself. And I'm like, I'm not going to do it by myself. So we did it together. You do yours by yourself, which I think is really impressive because I think just talking on your own is a challenge. Like, it's really hard to keep a steady stream going. So I think that's really incredible.
Well, you two have really good energy on your podcast. Like, you bounce off of each other really well. So it's like, I think it's what makes your podcast really unique too, is just like, having both of you guys there talking. And I know you guys talk a lot about very specific topics often too as well.
Right. Yeah.
And how long has the podcast been around?
It's been around, we started it in 2018. So like pre-COVID, we separate our lives into eras, like pre-COVID, post-COVID.
Yeah.
So we had, it's like, I go back and listen to them. Like, so we started it pre-COVID, and it was literally just like 2 microphones and a Zoom machine in our office after our clinic day. Before we got like a fancy studio. But that's how we started. And then, COVID hit. And I go back and I listen to those COVID podcasts as if we knew what we were talking about. Because we look back like nobody knew anything about COVID. Like, we still know very little about it. And it was such an evolving thing. And here were these 2 plastic surgeons trying to like break down what COVID was and like what we should do. And like, it was mostly right. But at the same time, it's like, nobody knew anything about COVID at that point.
You had a little extra time in your hands, so, it's like...
Might as well talk about COVID. So we went through the COVID, and then, it kept going. And I think mainly for us, it was the consistency. Like, all right, every Wednesday at 5 p.m., we're going to finish clinic, and we're going to go do this podcast. And I think that was the key, is just... This was not just like a hobby. It was really something that we dedicated time and commitment to, at this time of day, every single week.
I mean, I think you're probably one of the longest running plastic surgery podcasts out there, which I think is pretty awesome.
Yeah, there's a few others that have been out there. There was like 2 or 3 that I could think of that were long running before we started. I don't even know if they're still running though. So yeah, I think we're one of the more original of the podcasts. Even before podcasts were like that much of a thing.
Before they were a thing, exactly. Yeah. What's something that has kind of surprised you about the podcast? Is it, because I know you said like you're not big on being in front of camera and things, but like you're very good at it. You're natural. So what have you found that surprised you that you've enjoyed about it?
I think I'm surprised that I enjoy it.
You're like, you answered it for me.
Like I'm not, I don't seek out the limelight in that way, but I love what I do. And I do know that I'm pretty good at putting things into, verbiage and words that people can understand. Like I think that's really important when I talk to my patients directly in exam rooms. I try to break it down and explain things to them in a way that resonates and that they can understand. And so that's really all I'm trying to do with the podcast. And that's really easy for me to do because I love what I do and I just want to explain it. And I want to do it in an honest way. And I want to do it in a way that's like not manipulating patients. I can't stand that when the majority of the podcast that you're listening to is them like just marketing themselves or trying to sell something to somebody. When like, I just want to get the honest answers out there because there's so much marketing and manipulation that happens in our specialty and it drives me nuts.
No, I agree. And I've listened to lots of your guys' episodes and it really is great information. And like most things, we draw our inspiration for these from the things we hear every day, all day.
Yes.
And so it's just nice to be able to have a source where you just have 2 plastic surgeons who are just talking about real life experiences that they have with these topics.
Yeah, and that's literally all it is.
Do you guys know what your most downloaded episode is?
It's usually the celebrity ones. I think for a while, we had Mia Khalifa was like our #1 downloaded episode. And then Terry DeBro, he might have surpassed Mia Khalifa. So those have historically been like our best episodes.
The ones where people are like, okay, I know who these people are.
Yeah.
What do you guys see for the future? What do you see for the future of this podcast? Is this something you're going to like, yeah, we're going to keep doing this till we can't do it anymore? Or is there something more that you're like hoping to create with it, I guess?
I think that we will be doing it for a substantially long period of time going forward. We always talk about somehow turning it into more of a show, kind of like at one point we would have said like a TV show, like kind of a doctor-style TV show. But I think now the way things are moving, it would almost be more like a YouTube show or something like that.
Yeah.
Where it's, us on couches and maybe having guests or maybe going in and following a patient through a surgery and then talking about it on the show or something like that. So turning it into more of like a produced show would be something that we've kind of talked about for a while. So we'll see if that's possible.
And I tell you, they have these really cool microphone stands in their studio, so I could see where this could go a little bigger, a little bit bigger. But what about in plastic surgery in general? What are you excited about for the future of plastic surgery, specifically in your practice?
For me, well, the selfish answer, like what am I personally excited about, is really just always doing better and getting better. I feel like until you really hit the end, every single year you just get better. So what I love about that in my job especially is that there is no point in my life that I would want to go back to and be like, oh yeah, oh my gosh, my mid-30s, those were the best time of my life. Oh, I wish I was in my 20s again. Like that was such a fun time. I wish I could go back there. Like that does not cross my mind because for me, I'm like, but I wasn't as good as I am now. Like I don't know what I know now. And so every year that goes by, I mean, yeah, like the aging sucks, but how much better I can get at surgery and how much more I can learn and how much I can do, like that makes me excited. It's like, I don't want to even go back to last year because I wasn't as good last year as I am now. So that's exciting for me that like I look forward to aging in that regard because it just means that I'm going to be professionally getting even better.
I love that. That couldn't be a more surgeon answer if it tried.
I know. And I don't know what kind of surgeon. Like, am I going to be that surgeon that's around until I'm like 75 years old, like shaking with my bovie, and everyone in the OR is like, "Oh my gosh, take that scalpel away from her."
You're like, I don't know how to relax.
I'm not gonna be that person, but there's a solid chance I'm going to be that person.
Well, no, I mean, you obviously are a very skilled surgeon. And one of the things that's really nice about you is you're not just skilled, you're also fun. And there's a lot of really skilled surgeons out there who just aren't that great personality-wise. And we all know a few of them. But it's cool to... It's cool to meet a combination person like yourself, and I can see why patients are so attracted to you. You know, like because you're the whole package. So
I appreciate you saying that. I think right back at you. I think the reason you're able to get these people on your podcast and vice versa is because you do the same thing. Like, you were also really good at explaining surgeries. I mean, you were a natural when you came on our podcast. Like, our producer was like, she was great. Like, she totally knows what she's doing. Like, doesn't skip a beat. And I think, I mean, I don't want to toot our own estrogen horns, but I do think women are better communicators. I mean, we know this. And so it makes sense that, like, we're better able to communicate with patients in that regard without letting the egos get in the way.
I 100% agree, and I think that's an awesome way for us to end our podcast. But thank you so much for being on the podcast. And if any of our listeners want to find you, what's the best way for them to reach out?
I mean, I'm like circa 2000 here with the website. So that's, www.roveloplasticsurgery.com. I do have an Instagram, which is @roveloplasticsurgery. I am awful about checking direct messages, so that's not the most reliable way of getting a hold of me. But certainly going through the website, the contact page, or just calling the office directly is the simplest way.
And she has a gorgeous office in Beverly Hills, which you would definitely enjoy visiting. So thank you again so much for being on the podcast. And thank you all for listening. As always, I hope you learned something new.